Today we're going to talk about bleeding, what to do if somebody is bleeding. Most of what I'm talking about is aimed towards people living in third world countries, though these principles can apply to any country. So let's say you find somebody who's bleeding. What do? Most of the time people tell me they would apply a tourniquet. Did you know that in most scenarios you actually shouldn't put on a tourniquet, and then putting on a tourniquet can actually cause more harm in the long run? So let's talk about what I recommend you do. The first thing you have to do is to protect yourself. All of us want to help people, especially when they're hurt, and that's a good thing to do, but you want to make sure that you're protected in the process. Today, there's a lot of diseases that can be spread by contact with somebody else's bodily fluids, and blood is one of them. Most of us don't carry gloves around, but there are things that many of us have readily available that we can use. So if you don't have gloves, you can just use a plastic bag. Try to make sure that the plastic bag doesn't have a hole in it. A good way to do that is to just kind of blow it up and then check for any leaks. So this one does not have a leak in it, so it would be safe for me to wear it. And how do you wear a plastic bag? You just put it on your hands like that. The point is to create a barrier between you and somebody else's blood. You can use different kinds of plastic bags. It doesn't have to be one kind. There just needs to be a safety barrier between somebody else's blood and your body. For the case of my teaching, I'm only gonna have one glove on, though I would recommend you put two on when dealing with somebody else. What you wanna do in any case besides a puncture wound is to apply direct pressure. So say this is my injury, I would apply pressure directly on there with my gloved hand. How long do I wait before I check? Is the bleeding stopping? Is it not? I would recommend that you don't check for at least 5 to 20 minutes. If it looked like a big deep cut, go ahead and just apply direct pressure for 20 minutes before you check. Because in the process of checking, you might actually cause the bleeding to restart. Now the question comes, what kind of cloth should you use? The kind of cloth you should use is just a clean cloth. It can be anything, any material. If it's cotton or something that can soak up blood, it's a better thing to use, but the point of it is to actually apply pressure. Now let's say that you're applying that pressure and you notice that the cloth that you're using is becoming bloody as blood is oozing out from the wound onto the cloth and is becoming quite wet. What do? Do you take it off? That's what most people want to do. But that's not the right thing to do. What you want to do instead is to add onto it. So go ahead and get another piece of cloth and just put it directly on top. So now look, I have 2 pieces of cloth, and what I would do is apply direct pressure with those 2 pieces of cloth. If you need to apply more, you can apply more. The other thing you can do to help slow down the bleeding is to elevate the part of the body that is bleeding above the level of your heart. Now, how does that work, and how do you know where the level of your heart is? I'm gonna show you a neat little trick. So I want everybody to put their hands down at the side of their body. And what you're gonna start to notice if you look down is that the veins in your hand are starting to get big. Right now, your hands are below the level of your heart, and that is why those veins are getting filled. As you slowly lift up your hands, there will come a time when those blood vessels become flat. That is the level of your heart, and then you just want to move it higher than that. So in the case of my arm injury, I want to lift up my hand. I don't have to lift it all the way up here. Even lifting it like this will work. While I'm doing that, I still want to be applying direct pressure. Sometimes it becomes confusing when the person is horizontal. Which way is the level of the heart? Say that this is their head and the arm was injured. Which way do we point the arm? Do we point it towards the head? Do we point it towards the feet? Do we point it towards the floor? Do we point it towards the ceiling? Which way do we do it? Oftentimes, people tell me that we should point it towards the head. Even though when we're upright, I had us lift our arm towards our head, that's not what you always want to do. What will always be correct is if you point it up towards the ceiling or the sky. So if you are in a horizontal position, go ahead and lift up the arm this way, towards the ceiling or towards the sky. Now, what if you've done all that? You've placed multiple pieces of cloth on the bleeding area as well as elevated it, you're applying direct pressure, but the bleeding just isn't stopping. When do you know that you should be headed towards a doctor and that you can't take care of this by yourself? Go to the doctor immediately. If you find that the bleeding is not stopping in 10 minutes, if it's a large wound, what is large? If it looks large to you, go ahead and go. Obviously, if you can see any fat particles, that would be those little yellow things, or you can see bone or a tendon, anything that's exposed, you need to go to the doctor. Or if you're at all concerned the moment you see it. Always err on the side of going to the doctor than not. The things that I'm telling you are just the things that you can immediately do before you get to the doctor. What are things that you shouldn't do? Generally, you should not put on a tourniquet. Now, some people don't know what a tourniquet is, so let me just explain it to you. So say that I was bleeding right here. A tourniquet is a tight band that you place before the wound. And what you're doing is actually you're cutting off the circulation to that part of your body, and it works really well. It does slow down the bleeding, sometimes even stops it. The problem with this is that you are cutting off the circulation. So say that you were bleeding from here, you put this tourniquet on and you left it on for hours. What could happen is that you may have stopped the bleeding, but you may end up losing your arm because you cut off the circulation for too long and you killed the rest of your arm. In some cases, this is absolutely necessary. If you are far from medical care and you are bleeding profusely, you will need to do this. However, if you are close to medical care, you're not bleeding that much, please don't put on a tourniquet. Just apply the methods that I have used. So use your judgment, and obviously, when in doubt, do what you think is best. What I'm telling you does not replace the advice of a medical doctor or common sense. In summary, what do you do if you find that someone is bleeding and you want to help? The first thing you have to do is to put on your gloves. Be sure to check that there are no holes in them before you put them on. If there are, put on another bag or another glove. Next, when you see the wound, go ahead and apply pressure to it. You should be wearing your glove when you do that. Don't check for at least 5 to 20 minutes. If the bleeding isn't stopping with pressure and it's oozing through, go ahead and get another piece of cloth and apply that. And elevate. Elevate means towards the ceiling or towards the sky, and keep applying that direct pressure. While you're doing that, go ahead and head to the doctor so that they can take a look at it and take care of it. Lastly, don't put on tourniquets unless you absolutely need to. I hope you found this helpful in how to deal with bleeding. Nothing in these videos should replace the advice of your doctor. Be sure to watch more of our first aid and safety videos.